What is a fine needle aspiration for pancreatic diagnosis? Imagine a tiny needle helping doctors unlock the secrets inside your pancreas without major surgery. That's what a fine needle aspiration is all about. It's a simple, minimally invasive way to collect cells from a suspicious spot in the pancreas. When imaging tests like CT scans, MRI, or ultrasound find a mass or lesion, doctors often need to know if it's cancer or something benign. That's where a fine needle aspiration comes in. During the procedure, a very thin needle is carefully inserted through the skin or guided by an endoscope directly into the pancreas or the tumor. The goal is to extract a small sample of cells. If the doctor uses imaging guidance, like ultrasound or CT, they can see exactly where the needle is going, making the process safer and more accurate. When using an endoscope, the doctor places a tiny ultrasound probe on the end of a flexible tube inserted into the stomach or duodenum, which is the first part of the small intestine. This helps guide the needle precisely into the lesion. The procedure is generally safe, with only a small risk of complications, usually around 3 to 7%. It's performed by experienced specialists who know how to minimize risks. Once the cells are collected, they are examined under a microscope by a cytopathologist. This microscopic look helps determine if the cells are cancerous or benign. Sometimes, multiple passes with the needle are needed to get enough cells for an accurate diagnosis. In some cases, the sample can be tested further with special techniques like immunohistochemistry or molecular profiling. These tests can help identify specific genetic markers or other features that might influence treatment options, especially for pancreatic cancer. The most common method used today is endoscopic ultrasound-guided fine needle aspiration, or USFNA. It provides a close-up view of the pancreas and helps avoid nearby structures, making it highly precise. While FNA is very accurate, sometimes a core needle biopsy is preferred. This method collects a larger tissue sample, which can be useful if more detailed testing is needed or if clinical trials are being considered. Overall, a fine needle aspiration is a vital tool in diagnosing pancreatic conditions. It offers a good balance of safety and accuracy, providing crucial information to guide treatment decisions. It's important to remember that this procedure should always be performed by trained medical teams with experience in pancreatic diseases. The results need to be interpreted by expert cytopathologists. If you or someone you know is facing a pancreatic mass, talking with healthcare professionals about the best diagnostic options is essential. Every patient is unique, and personalized medical advice is always the best way to go.